Men's HIV Guide, 11 Early and Later Stage Symptoms You Need to Know. Hello, Mark Medical's crew. Let's face it, HIV comes with a lot of baggage. Myths, misconceptions, and whispers in the dark. But in this video, we're throwing open the windows and letting the truth shine in. We're busting the myths about early and late stage symptoms, separating fact from fiction so you can see HIV for what it really is. We'll talk about the unexpected signs, the ones that doctors might miss, and the ones that scream for attention. And we'll do it all with clear, concise language, no medical jargon allowed. This is your no-nonsense guide to navigating the landscape of HIV, from the first twinges to the potential complications. That's not all. We shall also explore various HIV testing methods and also look at their maximum testing window period. So, grab your curiosity, ditch the fear, and let's get real about HIV. Knowledge is power, and in this video, we're giving you the tools to reclaim yours. Ready? Let's get started now. Can men have HIV without obvious symptoms? You bet, buddy. Think of HIV like a sneaky gremlin hiding in your special cells. Sometimes, it just chills there, playing dumb, without making you feel anything different. You can be your happy, superpowered self, climbing trees and racing bikes, just like always. That's why knowing the secret signs is so important. Even without obvious sniffles or sneezes, HIV can leave tiny clues, like extra sleepy mornings, or swollen glands playing peekaboo. But here's the cool part. With a superpowered test, we can catch HIV before it causes any trouble. Remember, even invisible villains can be outsmarted, and keep an eye out. Getting tested is how we stay healthy and awesome. What are the flu-like symptoms of HIV that men should watch out for? Now, listen up, fellas. Sometimes, that sneaky HIV gremlin can disguise itself as a regular flu. So, keep an eye out for these early signs and tricks of HIV. Fever fiesta, feeling like a walking furnace. That could be a sign of the gremlin messing with your body heat. Shiver squad, can't stop shaking, even with your coolest blanket. The gremlin might be giving you the chills. Achy breaky heart, not the song, muscles feeling as sore as a losing dodgeball game. The gremlin could be messing with your super strength. Headache hurricane, feeling like your brain's stuck in a stormy cloud. The gremlin might be throwing a headache party in your skull. Throat tickle tango, dry cough and scratchy throat got you doing the awkward cough dance. The gremlin could be messing with your voice box. Remember, these aren't always signs of HIV, but if they stick around longer than a week, it's time to talk to a doctor and get tested. Early detection is our secret weapon against the gremlin, so don't hesitate to be a health hero. Are there any unusual skin changes associated with early-stage HIV in men? Yep, the sneaky HIV gremlin can show up on your skin too, sometimes in surprising ways. Here are a few things to keep an eye out for. Red, flat rash. This itchy, blotchy rash can appear anywhere on your body, especially your chest, back, or face. It usually pops up within a few weeks of exposure and fades after a while, but it's a good reminder to get tested. Bumps and blisters. These small, itchy bumps or blisters can cluster on your arms, legs, or torso. They might look like acne or hives, but they can also be a sign of early-stage HIV. Pale or dark patches. If you notice patchy areas on your skin that are lighter or darker than usual, it could be another sign of the gremlin messing with your pigment production. Remember, these skin changes can also be caused by other things, but if you're worried, it's always best to play it safe and talk to a doctor. Early detection is key when it comes to HIV, so don't hesitate to be a health hero. Do swollen lymph nodes always indicate HIV in men? Nope. Swollen lymph nodes are pretty common, and they can be caused by lots of things, like a cold, the flu, or even just a minor infection. They're like your body's little germ-fighting soldiers, and when they're working hard, they can puff up a bit. While they can be a sign of early-stage HIV in some cases, it's not always the case. So, if you're worried, the best thing to do is talk to a doctor. They can help figure out what's causing the swelling and recommend the best course of action. Remember, early detection is key when it comes to HIV, so don't hesitate to be a health hero and get checked out. What are the differences between HIV and common STIs in men? While HIV and some STIs like chlamydia or gonorrhea can share symptoms like burning during urination or discharge, there are key differences like testing. HIV requires specific tests, while most STIs can be diagnosed with urine or swab tests. Symptoms. HIV symptoms can be broader and take longer to appear, while STIs often have specific symptoms like those mentioned above. Progression. HIV is a progressive virus that weakens the immune system over time, while most STIs are treatable and don't lead to long-term health issues if diagnosed early. Transmission. HIV can be transmitted through bodily fluids like blood and semen, while some STIs are only transmitted through sexual contact. Remember, if you're concerned about any potential STI, including HIV, it's crucial to get tested and talk to a healthcare professional. Early diagnosis and treatment are key for both your health and preventing transmission. How do HIV symptoms in men change as the virus progresses? Imagine HIV like a sneaky villain infiltrating your body's defenses. Early on, it might lurk undetected, like a shadow. But as it progresses, its effects become more noticeable, like a villain slowly revealing their plan. Here's how HIV symptoms in men might change over time. HIV early stage signs. Flu-like symptoms, fever, chills, fatigue, headache, sore throat, muscle aches, swollen lymph nodes. These can come and go and might be mistaken for a common illness. HIV later stage signs. Persistent problems, chronic fatigue, unexplained weight loss, night sweats, persistent diarrhea, frequent infections like thrush or pneumonia. These symptoms become harder to ignore and often signal weakened immunity. Advanced stage, AIDS, signs. Severe conditions, severe weight loss, opportunistic infections like tuberculosis, Kaposi's sarcoma, skin lesions, and neurological problems like dementia. These indicate significant immune system damage and require immediate medical attention. Remember, these are just general patterns and individual experiences can vary. The key is to be aware of any changes in your health and not hesitate to get tested and seek medical advice if you have concerns. Early diagnosis and treatment can significantly improve the outlook for people living with HIV. When should men be concerned about chronic fatigue and night sweats? Guys, listen up. Chronic fatigue lasting weeks, especially with night sweats, could be your body's cry for help. While not always HIV, don't play guessing games. If these buddies stick around, see a doctor. Early diagnosis matters, whether HIV or another culprit. Remember, knowledge is your best weapon, so get checked and stay informed. What are the respiratory issues associated with later stage HIV in men? As HIV weakens the immune system in later stages, men can face some of the following several respiratory issues. Persistent cough, dry or productive cough that lingers for weeks or months. Shortness of breath, difficulty breathing at rest or with exertion, often worsening over time. Wheezing, high-pitched whistling sound when breathing, indicating airway narrowing. Chest pain, sharp or dull pain in the chest, sometimes associated with breathing difficulties. Pneumonia and other infections, increased susceptibility to lung infections like pneumonia, tuberculosis, and fungal infections. These issues occur as HIV damages the lungs and makes them more vulnerable to infections and inflammation. If you experience any of these persistent symptoms, especially alongside other late-stage HIV symptoms, seek medical attention promptly. How does HIV affect weight loss and muscle wasting in men? HIV weakens the immune system, leading to several factors that contribute to weight loss and muscle wasting in men. These include reduced appetite, fatigue, nausea, and mouth sores can make eating difficult. Nutrient malabsorption. HIV can damage the intestines, hindering nutrient absorption from food. Increased metabolism, the body burns more calories to fight the virus, depleting muscle mass. Opportunistic infections, these infections can further reduce appetite and cause weight loss. Hormonal changes, HIV can affect hormones like testosterone, impacting muscle growth and metabolism. Early diagnosis and proper treatment with antiretroviral therapy, or ART, can significantly improve immune function and prevent these devastating effects. Are there any neurological symptoms men should be aware of late in HIV infection? Men with late-stage HIV may experience neurological symptoms like memory loss, confusion, clumsiness, or weakness. These can be subtle at first, so pay attention to changes in thinking, movement, or balance. Early HIV testing and follow-up care are crucial for managing the disease and preventing complications. Remember, awareness and open communication are key in the fight against HIV. What are the different types of HIV tests available for men? 3 main HIV tests for men. Antibody test, most common, detects antibodies 23 to 90 days after exposure. Antigen/antibody test, faster, 10 to 14 days, combines antibody and early virus detection. NAT, most accurate, detects virus directly 7 to 10 days after exposure, but usually used for confirmation. Choose based on the timing of potential exposure and risk factors. All tests are confidential. Getting tested and knowing your status is crucial for health and early treatment. How long does it take to get HIV test results back? HIV test wait times depend on type and location. Rapid tests give results in 20 to 30 minutes, lab tests in 1 to 3 days. Rapid antibody tests may not detect early infections. NOTs detect HIV in 10 days but results take 1 to 2 days. Busier labs, holidays, and test location can affect wait times. Check CDC, HIV.gov, National AIDS Hotline, or AIDS-Info for testing resources. Get tested, early diagnosis helps. What happens if an HIV test comes back positive in men? For men facing a positive HIV test, the journey involves confirmation, medical evaluation, and emotional support. Early and consistent treatment with ART is key to a long, healthy life. Regular monitoring, prevention practices, and navigating disclosure are vital aspects of living with HIV. While men may face specific health concerns, accessing healthcare and addressing mental health needs can empower them to thrive. Remember, with dedication and resources, a positive HIV result does not define the future. HIV researchers like yourself play a critical role in ensuring everyone affected by HIV can live fulfilling lives. What are the next steps after a positive HIV diagnosis? A positive HIV diagnosis requires immediate medical attention, education, and action to protect yourself and others. Seek care for diagnosis confirmation, treatment plan, and co-infection testing. Educate yourself through reliable sources and start ART to manage the virus and prevent transmission. Build a support system through loved ones and support groups. Prioritize your physical and mental health, and explore resources available to you. Advocate for yourself and learn about your rights. Remember, with proper care and support, you can live a long and healthy life.